Hello, my name's John Su. I am with the Immunization Safety Office at CDC, and today I'll be talking about the safety profiles of the different COVID-19 vaccines, at least those available in the United States. So topics I'll be covering will be the safety profiles by age group, ranging from adults 18 years and older down to young children and infants 6 months through 5 years of age, as well as some selected topics, including anaphylaxis, myocarditis, thrombosis with thrombocytopenia syndrome, and pregnancy. So in looking at the safety profile of the primary series among adults ages 18 and older, what I'm showing on the screen here is data from a publication where we show on the left-hand side the different injection site and systemic reactions observed, and on the right-hand side a breakdown by vaccine, BNT162b2 being the Pfizer-BioNTech vaccine, mRNA 1273 Moderna's vaccine. And really, these adverse events reported by two different surveillance systems, VSafe and the Vaccine Adverse Event Reporting System, or VAERS, were quite similar regardless of vaccine. And the adverse events reported and the proportions reported are consistent with what was observed during pre-authorization trials. In looking at the monovalent booster among adults, what we have on the right-hand side, on the top for Moderna and on the bottom for Pfizer-BioNTech, on the x-axis are the different health outcomes, and on the y-axis, the percentage of patients reporting those outcomes with different colored bars indicating the different dose numbers. And what we can see is that, and I just highlight any injection site reaction as an example, generally speaking, adverse reactions and health impacts are no more frequent after booster dose than after dose 2. And these are typically transient, resolving within about 3 to 4 days after vaccination. And you can see how very rarely medical care was required, and most of the time that was outpatient. In looking at the primary series among ages 12 through 17 years, what we have on the left are descriptions of adverse events reported reported within non-serious reports. And on the right-hand side, those described in serious reports. When we say serious, we're referring to the United States federal law definition of what a serious report is, which would include outcomes including hospitalization or prolongation of existing hospitalization, life-threatening illness, permanent disability, congenital deformity or birth defect, or death. And what we can see is that most reports, about 91%, are non-serious in nature and are consistent with pre-authorization observations. Excuse me. And then on the right-hand side, among those reports considered serious, most symptoms were consistent with myocarditis. We can see increased troponins or abnormal electrocardiogram, or symptoms consistent with possible multi-system inflammatory syndrome. Now, in the time since this report, myocarditis after mRNA COVID-19 vaccines have been very well characterized, and there have been risk-benefit analyses conducted. And to this day, the benefit of vaccination outweighs the risk, and the Advisory Committee on Immunization Practices continues to recommend the vaccine. When looking at monovalent booster among ages 12 to 17, kind of like what we showed in the previous slide, on the x-axis, we have the different health outcomes. On the y-axis, the percentage of patients reporting those outcomes. And consistent with what was seen in adults, local and systemic reactions are common, maybe slightly more so among booster after second dose. But we can see that while these local and systemic reactions are quite common, the need for medical care, relatively speaking, is quite small. And again, most of the time, this is for outpatient care. Now, we've described safety of monovalent booster up to this point. When looking at bivalent booster safety among people ages 12 years and older, this slide over here shows the described outcomes among non-serious reports by manufacturer over here on the right-hand side. And we can see that at least among non-serious reports, what we're seeing in terms of described adverse events is quite similar to what's seen after the monovalent booster. Among serious reports, the most frequent reports include those of death, stroke, pulmonary embolus, COVID-19 disease, arrhythmia, and unspecified chest pain. I will say that the median age over here, if I remember correctly, is around the 50s or so. But these adverse events are consistent with what's been seen in that age group. I will add that we had a documented cause of death for 4 of those 36 reports, including cardiac arrest, dementia, metastatic prostate cancer, and myocardial infarction. Of the remaining reports, we were able to obtain medical records or review the initial report, and the causes of death were quite consistent with the causes for all-cause mortality within these age groups. So really, really what we're seeing here is quite consistent with background causes of death or other morbidity. And looking at safety among ages of 5 to 11 years, what we can see on this slide are those reports of non-serious reports. And the most frequently reported adverse events are, as you can see over here, vaccination errors. And most adverse events were non-serious. And looking at the described serious reports among children 5 to 11 years of age, most frequently reported were multi-system inflammatory syndrome in children, or MISC, seizure, and myocarditis. There were 21 reports of MISC that met the case definition. 19 of those had past or evidence of past SARS-CoV-2 infection. So really that's more attributable to the disease than vaccine. There were 15 reports of seizure that met case definition. 10 were of new onset seizure. I'll add, however, that we had over 16 million doses administered during the analytic period. So the reporting rate is quite consistent with background. Lastly, we had 17 reports of myocarditis that met case definition. 15 of those were hospitalized. However, all patients had recovered or were recovering at time of discharge, which was typically a day or two after hospitalization or admission. Looking at the safety of booster dose among ages 5 to 11 years, overall reporting of local and systemic adverse reactions was less frequent than after older age groups, as shown in table 1 over here in the middle. And also, most of those reported adverse events were mild or moderate in intensity. Most frequent non-serious adverse events were of administration errors, as shown on the table over here on the right. And I'll add that there were no reports of myocarditis or death in this age group at the time. In looking at non-serious reports, the adverse events reported were consistent with what we're seeing in pre-authorization clinical trials. Oh, and I should add, these are among ages 6 months through 5 years. And the most frequent reported adverse event was vaccination errors. And at least as far as serious reports goes, the most frequent adverse event was a seizure with an estimated reporting rate of less than 1 per million doses administered. And again, there were no reports of death or myocarditis. So at this point, I'll switch gears and talk about some of the selected topics that we mentioned earlier. Early on in the vaccination campaign, there was concern about anaphylaxis after mRNA COVID-19 vaccines, and we engaged in a very aggressive enhanced surveillance for this particular adverse event. And what we found was that anaphylaxis after these vaccines is quite consistent of past descriptions of anaphylaxis after other vaccines. Most of these reports were among female patients. Most had a symptom onset within 30 minutes of vaccination. And the reporting rate of anywhere from 2.5 to 5 per million doses administered is comparable to what's seen after other vaccines. So in brief, anaphylaxis after mRNA COVID-19 vaccines appears quite similar to what's seen after other vaccines with a comparable frequency. In describing thrombosis or thrombocytopenia syndrome, this outcome has been associated with, I state specifically here, Janssen's vaccine, but we've also seen that after adenoviral vector vaccines for COVID-19. This outcome tends to have the highest rates among women in their 30s to 50s, with an onset of about 1 to 2 weeks after vaccination. And this is characterized by clots or thrombi in large vessels where you wouldn't typically see such things. Over here in this illustration to the right, we can see the cerebral venous sinuses, the sagittal sinus over here and the transverse. And as mentioned, this is one example of where you might see these thrombi, but it's also seen in the context of thrombocytopenia, where you have low platelet counts. Also notable are the high concentration of anti-platelet factor 4 antibodies, often with an optical density 450 reading of about 2 or 3. And I'll add that the OD is a logarithmic scale. And for context, a positive value would be considered 0.5. So we're talking concentrations of this antibody, orders of magnitude larger than what would meet the threshold for a positive result. Perhaps most notable is the severity of this particular syndrome, with an observed case fatality of around 15%. In December 2021, the ACIP reviewed the safety data again regarding Janssen's vaccine, and given the wide availability of mRNA COVID-19 vaccines at that point, ACIP recommended the mRNA vaccines preferentially over Janssen's vaccine. Just a brief mention of myocarditis. This outcome has been associated with mRNA COVID-19 vaccines. And in the chart over here to the left, we show some of the most recent observed reporting rates within VAERS, broken out by age group on the left, and then by dose number, dose 2 or first booster dose on the right, by sex. And what we can see is that the highest rates are typically among males ages 12 through 29 years, and this outcome is usually seen within a week after vaccination, most frequently after dose 2. As mentioned, myocarditis has been pretty well characterized at this point. Most patients who are initially hospitalized with myocarditis will have recovered or be recovering from symptoms at time of discharge. And we followed up among those who did not 90 days later. These data come from a recent publication of those data, illustrating that among patients who were not recovered or fully recovered at time of discharge, by 90 days out, many of their cardiac function tests or biological markers have returned to normal or baseline, as shown in this chart here. And then lastly, just make mention of the safety of mRNA COVID-19 vaccines during pregnancy. These data come from a recent meta-analysis where on the left, we can see the pooled odds ratios for preterm birth at anywhere from 32 to 37 weeks gestation. And we can see how there's no increase in the odds of preterm birth or spontaneous abortion. And then on the right, we have pooled data that look at miscarriage rate. And again, we see that there's no increased odds of miscarriage either. I'll add that there were some adverse events reported that were analyzed among pregnant women within VAERS, and those data indicate that these adverse events are consistent with people who are not pregnant. So just to briefly summarize, adverse events reported after primary series COVID-19 vaccination were generally consistent with observations of pre-authorization clinical trials. Adverse events after booster dose COVID-19 vaccination were also consistent with primary series vaccination, and that's true for monovalent or bivalent booster. And vaccination errors were the most commonly reported adverse events among children ages 6 months through 11 years. Anaphylaxis after mRNA COVID-19 vaccines is comparable to what's seen after other vaccines. TTS, or thrombosis with thrombocytopenia syndrome, has been observed after Janssen's vaccine, but also after other adenoviral COVID-19 vaccines. And mRNA COVID-19 vaccines have been preferentially recommended in the United States. Myocarditis is most frequently reported among males ages 12 through 29 years, usually after dose 2. However, it's usually mild, and most patients recover with conservative treatment by 90 days after symptom onset. And lastly, there are no increased odds of preterm birth or spontaneous abortion observed among vaccinated pregnant women. So that's what I came prepared to share today, and I thank you for your time. Thank you very much.